Greetings and welcome to my channel. Before we begin, please go ahead and click the like, subscribe, and notification bell. 10 types of headaches you need to know. Headaches can be a literal pain and disruption of peace. They are uncomfortable and are mostly a common complaint by many people. The shocking thing about headaches is that these days almost every other person is experiencing some sort of headache, and it causes a lot of hindrance in daily life, whether personal or professional. But how many of you know the types of headaches? We have compiled a list of 10 types of headaches to make you aware of, so make sure you like and share this video. Let's begin. Tension headache. If you are suffering from a tension headache, you might experience aching sensations, a dull feeling all over your head. It can start from a mild to moderate pain at the back of your head, and sometimes the neck too. It creates tension or a feeling of a tight headband around your head. This is the most common type of headache, also known as a stress headache, mainly because stress triggers this kind of headache. If it continues to happen regularly, then tension headaches can become a chronic illness. Cluster headache. This kind of headache is characterized by severe piercing or burning pain. It mostly occurs around one eye or one side of the face. It can even cause facial swelling, redness, flushing, and sweating. Cluster headaches also lead to nasal congestion. It's one of the least types of headaches. Medical studies are yet to define the causes of cluster headaches. Migraines. Migraine is described as an intense pain that happens from the depth of the head. This kind of headache can last for various days and can strongly impact the daily life routine of the affected individual. Along with intense pulsing, migraine comes with a throbbing sensation. People suffering from migraines can be sensitive toward certain sounds, light, and even food. Moreover, nausea and visual disturbances are very common in migraine. Intense migraine can cause tingling sensations or trouble speaking. Allergy or sinus headache. Some headaches happen due to certain diseases or viral allergies. Such kinds of headaches are known as sinus headaches because they occur in the sinus area and forehead. People who suffer from any viral disease have a high probability of suffering from this kind of headache. Hormone headache. Hormonal headaches are common among women. This kind of headache happens frequently among women because of hormonal fluctuations caused due to monthly menstrual cycle, PMS, consumption of birth control pills, and pregnancy. Headaches associated with the menstrual cycle are most commonly called menstrual migraines. They are prone to happen before, during, or after the menstruation cycle. It can also occur during the ovulation period. Caffeine headache. Many of us are caffeine addicts. We survive on tea or coffee in our daily life. Isn't that true? We also prefer the intake of caffeine for any headaches or extra energy to be productive. For the time being, it helps minimize the inflammation and gives a sense of relief, but it can eventually cause severe headaches. This can frequently happen when you are an habitual caffeine drinker. Alarming to know that caffeine highly affects blood flow to the brain. The key to getting rid of such headaches is to consume 0 to very little caffeine and quit the intake on a regular basis. Exertion headache. Exertion headaches are prone to happen quickly after high or intense level of physical activity. Such activities include running, weightlifting, swimming, and tennis. Exertion headaches are prominently known as exercise headaches. Moreover, they can become severe very quickly, and if care is avoided, then it can also lead to signs of abnormalities in the brain or other chronic diseases. Hypertension headache. Hypertension headaches are related to high blood pressure levels. They are caused by elevated levels of blood pressure. This type of headache is an emergency sign for professional help. That is why it is called the silent killer, because it doesn't cause any prominent symptoms for several years. Hypertension headaches usually occur in both sides of your head and end as soon as the blood pressure levels are normal. Rebound headache. This might be very new to a lot of people. Rebound headaches can make you feel tired and dull, and it's almost like a tension causing a headache. It is also known as medication overuse headache. Rebound headaches can be powerful and intensely painful, just like a migraine. Post-traumatic headache. Post-traumatic headaches can happen after a certain traumatic incident or injury. It can become very intense, just like a tension type or migraine headache. Post-traumatic headache is known to last from 6 months to 1 year after the head injury or any similar disease. This kind of headache can become chronic in no time, though certain care and medications can ease the pain.